Good afternoon. Thank you for your presentation. And on behalf of my colleague, I'm here to present the paper on the assessment of occupational radiation exposure from CT examinations. So, as we all know, the CT is the technique that is evolving and have every time more importance in the diagnostic radiology. So during the past few years, efforts have been made to reduce the radiation doses in CT on the patient and also in the staff that working with this technique. But the number of CT examination is always increasing. Therefore, the concern of occupational radiation exposure raised as well. So the main goal of this study was to assess the occupational radiation exposure on the radiographer from the CT scan room. So in this study, the survey has been carried out about the measurements of radiation in operating room from the 6 licensed CT equipment. The measurements were performed during different types of the procedures using personal TLD dosimeters and the portable radiation measurement instrument, ionizing chamber, both placed in the radiographer operating station. As we can see here, with D0 we have our gantry, our center of the acquisition, and with D1 we have our position of our measurement instruments. So this way, this device was posted on the position of the radiographer, and the background and the radiation from the scan was measured. The sensitivity of the detector is of 10 kiloelectrovolts. The data acquisition to determine the background radiation to the occupational radiation exposure was measured during 2011 hours in 60 seconds timing. And the units we were used was micrograys per hour and millisievert per year. So as the results, we have here the measurements of our background results of the background radiation, as we can see here. And we have determined that during the day, per day, the background radiation was 0.112 microgray per hour, 1 millisievert per year. And the occupational radiation exposure obtained with the portable radiation was 0.214 milligray per hour, as we can see in this figure. So, considering the radiographer work schedule of 35 hours per week and 47 weeks per year, the occupational radiation exposure that we calculated was 1.4 millisievert per year. Considering those limits in Portugal, in our country, these values are below the national limits. We also measured the most contributive CT examination for the occupational exposure were pelvis, abdomen, and lumbar spine, as we can see here in this graphic. Here, abdominal, lumbar spine, and pelvic. So in conclusion, as I said before, the doses occupational exposure on the radiographer is lower than the limits that are established in our national law. However, it's always good to minimize radiation doses to educate the professionals and the other professionals in like in physics, medical physics and others, increase our protection for our good, so we don't get any risks in our work. Thank you for your attention. It's all for my part.
Perfect. Excellent.